House Bill 2, Representative Tides.
Representative Todd, you have the floor.
Thank you so much. I don't know whether to thank you all or not.
I got a good guess.
Here we are again, and I think, I know the outcome of what we're about to do, but I did want to make just a couple of points. I know we got a long agenda, and, I don't want to belabor this point, but if you all looked at got your mail out of your mailbox yesterday, you obviously saw a copy of the State Legislators magazine that highlights the states that are moving towards looking at different forms of decriminalization of marijuana, many for medical purposes. I made my testimony this summer about why I feel so engaged about this, because I have watched a lot of people that I care about suffer at end stage of cancer, HIV/AIDS, and other diseases. And I realize that many of y'all around the table haven't had the experience that I've had and watched how marijuana can ease the suffering of someone who's in that position, especially somebody you love, and that you want to do everything in your power to increase the quality of their life. The brownies are courtesy of me. They do not have marijuana. I actually had to go to security yesterday, and I said, I'm going to bring some props for my hearing tomorrow. They're not real, so don't arrest me for that. But I'm trying to make the point that I think a lot of people think that we're trying to get to a point where everybody's going to be smoking and toking on their front porch. That's not what we're talking about. This is actually the most effective way that most people who have cancer or other diseases digest marijuana. So it can be baked in many products. So, this is sort of, I guess, my little joke to you all. I hope you enjoy them. I did make them. They're gluten-free. So, and I hope that, I know how this vote's going to go. I know where we are in Alabama on this. But I really do hope that at some point we can step back and have a serious discussion about what other states have done that have been successful, how we can develop maybe a model project here that is very small scale, that we can work out the kinks of this. But there are a lot of people that are hurting and that need this relief. And it's just another tool in the medical toolbox for me. We're more and more physicians are coming forward in favor of this, and I think you'll be hearing from them throughout the months as and I hope we can continue this dialogue in some form. The reality is, when we look at drug reform laws beyond just medical use, our prisons are overcrowded. Our state prisons are overcrowded with people who are there for simple possession. I think we need to look at that. And obviously Alan has a ton of street experience around this issue. I come from a compassionate side of, I've seen the benefits of this. And I know I had a 60-year-old woman in my office last week, and this is no kidding, lives in my district, came to see me, been diagnosed with end-stage cancer. She is currently getting cannabis oil from Colorado. Has a connection there, they ship it to her, and it's something that has actually, she's able to work in her garden, have discussions with her family members that she was not able to do before, and it's a pill like this. So I want you all to understand that this is an issue that I think is going to continue to grow in popularity and also policy-wise. We're seeing that. 13 states have already taken action to look at this. I truly believe that this drug is different than all, cocaine, heroin, meth. It has extremely different properties, and it's been used for medical purposes since the first person ever discovered it. So all I'm asking for is, I know you're going to vote this out, or you're going to kill it. All I'm asking is, can we somehow continue this dialogue to increase all our comfort levels around this and understand all the policy issues and implications as we move forward, as other states are going to do too. You know, I've been in communication with law enforcement, public health over the summer, talking about this issue, and I understand the hesitation. You know, this is Alabama. But we do like, you know, for me, it's a no-brainer. I don't want to start crying about this, but when you have watched something you love with all your heart, who cannot even speak, they're in such agonizing pain, and the quality of their life is so diminished that the family is desperate for help. Morphine, of course, provides a lot of relief to people at any stage, but also has adverse effects. People can't function on morphine, and I'm just asking, please, 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 give us a chance to look at this seriously and from a medical perspective, so we can provide relief to some people that are really hurting. And I thank you for your time.
Thank you. Do we have any questions from any of the committee members? Representative Todd, Representative Hubbard, you're recognized.
Thank you, Mr. Chairman. And Representative Todd, I appreciate your work on this legislation. And we had the public hearing back in November on this, and I appreciate you having all those folks come speak to us. Some of them are here today. And I've had an opportunity to talk to some of my constituents and some other folks around the state about the importance of studying this issue as you asked us to do. And this isn't about legalizing a drug. It's about learning more about these quality of care issues that affect many Alabamians. And I realize that, you know, polls dictate a lot of decisions up here, and that's concerning for many of us. But I do think you raised important questions about the effects on palliative care that THC has, whether in the form of cannabis or oil, or some of these new medications like Cidovox, or even Marinol in some ways. And I think, I believe it was Mr. Medlock might have raised the issue about how his insurance company doesn't provide coverage for some of these medications. And those are issues I think, Mr. Chairman, this committee needs to study. And I don't know that this bill in its present form is something I can support.
Sure.
But I want you to know that this issue is something this committee, I believe, Mr. Chairman, needs to work on, look at, and study. It's a palliative care issue that affects citizens in every one of our districts. And so with that, Mr. Chairman, I move that we carry this bill over.
I have a motion before us to carry this bill over. Do I have a second?
Second.
A second from Representative Treadaway. The motion is to carry the bill over, which in effect will delay the vote on the bill. All in favor of carrying this bill over, say aye.
Aye.
Opposed to carrying this bill over, say nay.
Nay.
And the nays have it. Any other questions or comments from members of this committee?
I'd like to request a roll call vote.
A roll call vote has been requested by Representative Patterson. The clerk will call the roll.
Dr. McClendon?
No.
Mr. Milliken?
No.
Mr. Knight?
Yes.
Mr. Johnson?
No.
Ms. Hall? Mr. Treadaway?
No.
Ms. Beach? No. Mr. Chasteen?
No.
Mr. Fort?
Yeah.
Mr. Henry?
No.
Mr. Hubbard?
No.
Mr. Lee?
No.
Ms. Norgren? No. Mr. Patterson?
No.
Ms. Weaver? No. We have 2 yeas, 12 nays.
Thank you, Mr. Chair.
And thank you, Representative Todd, for your passion on this bill.
I'll be
For-
back.
We have 2 more bills to take up today. Any of